Good afternoon from Copenhagen, Denmark at the European Society of Cataract and Refractive Surgeons. We're pleased to have with us this afternoon Dr. Farzad Hafezi from Zurich, Switzerland. Thanks very much for being here today.
Thank you for the invitation.
Now, I understand that you are developing a new technology to bring cross-linking to the slit lamp. What's that all about?
Well, after we thought about it a long time, and what we see the need for in cross-linking at the slit lamp is to give ophthalmologists in all areas of the world access to the technology. And not everybody has an operating theater disposition, and if you boil it down, the smallest common factor we all share is a slit lamp. Everybody has a slit lamp if it's an ophthalmologist.
Mm-hmm. So what do you see are the applications? Do you think that people can be treating things like keratoconus at the slit lamp, or do you see that there may be other applications as well?
We see two major applications. Besides keratoconus, the main application for this device will be corneal infection. Mm-hmm. And in order to do so, we had to establish a lot of underlying research to be able to transfer this technology from the operating theater to the slit lamp. As we all know, we are all facing patients that come in with a contact lens-induced corneal infiltrator ulcer. It's a bothersome problem in industrialized countries. It's a huge problem in other areas of the world, and the WHO speaks of a silent epidemic, citing numbers of almost 1 million cases of corneal infection in India alone. So there's a huge demand, and taking this to the slit lamp might help ease the access to most of the patients.
Well, I'm glad that you brought that up, because we've heard very positive sessions about using cross-linking in infectious keratitis over the past few years, and from what I understand, these types of treatments can be a one-time treatment. Is that correct?
That's what we aim for. If the ulcer is still small and defined, it might even be a one-time treatment. And what we've been working on is accelerate the technology without losing efficacy. Nobody can sit at the slit lamp for half an hour, but we brought it down to 180 seconds. This is published data in the JRS. So you can kill 99% of multi-resistant Staph aureus in just 180 seconds. And one other beautiful characteristic of the technique is that it is efficient in bacteria, in multi-resistant bacteria, and also in fungi. So the mixed infections that often are a major diagnostic challenge for us, you just kill both arms, the fungi and the bacteria.
That's terrific. Do you foresee that there may be an age limitation to collagen cross-linking for this indication? I know that we typically talk about cross-linking for ectasia for people in their, let's say, 20s through 40s, but is this an application that could be a wider age range?
We think so. We have a prospective randomized multicentric trial running since almost 1.5 years, including 11 sites in 10 countries. And we have included patients of all age, but we've limited the ulcer size to 2 millimeters and 300 microns depth.
And I wonder if over time we may find that larger ulcers, either in width or depth, may also be candidates for this type of treatment.
We think so, but for the sake of the new method, we want to protect the new method of people trying too much on a promising new method. So we will start small and then try to successively enlarge the spectrum of indications.
Let's talk a little bit about the device itself. How does the device logistically interface with the slit lamp, and what are some of the technological aspects that the device can do?
Well, the device fits on, for the time being, on all Haag Streit and Zeiss models, and we're also aiming for the Topcon models and the lookalikes. Mm-hmm. So this should cover a large portion of the slit lamps. And if you look at a Haag Streit slit lamp, for example, there are two arms that usually touch, and this is where you can take off the small cover, and you have a hole into which the device can be positioned. Mm-hmm. And then the working distance is 7 to 8 millimeters. Long lashes might touch the device, so you have a sterile cap, a sterile interface, a single use. And we had to include safety measures. One safety measure is the device measures the fluorescence in real time, 10 times per second. And if the fluorescence is not enough to allow for a safe treatment, the device will refuse to irradiate the cornea.
Farzad, what about the intensities? What types of intensities are capable with this type of slit lamp device?
The device will deliver 3, 9, 18 or 30 milliwatts. So you have the full range of corneal infection treatment at high intensities. and also of keratoconus treatment. So you could do a 10-minute or 5-minute classic epi-off cross-linking treatment at the slit lamp.
And I suppose the question comes up of what are some of the benefits of doing a treatment at the slit lamp instead of in a procedure room. One of the interesting things about doing a procedure like this in an aseptic environment is that you're sort of taking a septic situation and bringing it into an aseptic environment in a treatment room.
Exactly. So why would you bring the septic patient, as you say, into an aseptic environment to perform an antiseptic procedure? Mm-hmm. And if a patient comes in with an ulcer, we are facing the patient in the examination room, and we will disinfect this cornea with the UV irradiation and the riboflavin, so we might as well stay at the slit lamp. Mm-hmm. And it heavily reduces the cost because not everybody can afford the operating theater infrastructure.
Mm-hmm. And as well, in terms of cost reduction, it may also reduce the number of visits and the number of medications that patients must acquire.
That's a major point, exactly. What we heard is that, well, why do we need this treatment if the cost of antibiotics is so low in India? Which is true, but the cost of the doctor's visit is the limiting factor. If you have to see a doctor half a dozen times or more, this is where the money is spent.
Well, this is such an exciting adaptation of technology, and we're really excited to see it progress over time. Thank you so much for sharing your expertise.
Thank you.